Reflect on the world as it was in 2019. Can you even remember what life was like in the pre-pandemic world? The world was full of its polarities and complexities and inequalities. The rich, the poor, the beautiful, the ugly, the aspiring and the downtrodden, the healthy and the diseased. As the last light from the corona of the sun was falling on the earth in 2019, a different corona was being birthed. Soon, there were reports of a mysterious illness circulating in China. Wuhan, China became the center of focus. China quickly built 2 hospitals to deal with the emerging crisis. In under 2 weeks' time, the 1,000-bed Huashen-Shan and the 1,500-bed Lishan-Shan hospitals were erected in Wuhan. Chinese cities were vigorously locked down, and stories emerged of Americans trapped in Wuhan. The 30th of January 2020, the Director General of the World Health Organization declared the novel coronavirus outbreak a public health emergency of international concern, WHO's highest level of alarm. As the fear and concern spread through the world, comparison was made to historic pandemics. Terms like asymptomatic carrier and fatality rate and replication rate were pondered. The virus could be spread in the air. The virus could live on surfaces. Predictive pandemic models were developed that anticipated over 2 million deaths in the USA if nothing was done. And then, the 11th of March 2020, the World Health Organization declares the novel coronavirus outbreak as a global pandemic. In the USA, New York City soon became a focal point. Powerful images began to emerge. The naval hospital ship USNS Comfort was deployed to relieve potential overcrowding in the hospitals. Refrigerated trucks holding COVID victims were seen as the morgues began filling up. Drone images of burials of unclaimed bodies on Hart Island created a dark sense of fear about the pandemic's relentless spread. Andrew Cuomo's daily coronavirus briefings were welcomed as a comforting and stabilizing voice. The daily White House briefings, while informative, by contrast, were often contentious. In a complex web of science and political theater, the Trump administration and federal agencies sought effective policy and action to manage the pandemic. In mid-March 2020, the 15-day Slow the Spread campaign was launched. Later in the month, it was extended to the 30-day Slow the Spread. Despite Trump's optimism that the pandemic would quietly pass, the case numbers and fatalities just continued to climb. There were emergency orders and lockdowns. Frequently conflicting guidance was issued for social distancing, mask wearing, hand washing. Schools closed, colleges went online, businesses, restaurants, bars, and gyms shuttered their doors. Unemployment soared. The stock market plunged deeply. There were protests, often violent, in the streets. Everyday life was affected for nearly everyone in the world. And there was hope for an effective vaccine. Let's fast forward and look at the data. The USA in late 2021 is approaching 48 million confirmed cases and 800,000 COVID-19 related deaths. While COVID-19 is a serious infectious disease, the relatively low case fatality rate of about 1.6% has spared the world a much worse outcome. In a list of human disease case fatality rates, COVID-19 is preceded by over 50 other diseases with much higher CFRs. Let's mention mainstream news media briefly. The emphasis on detailing COVID case numbers in anxious and somber tones is common. There is a strong bias towards reporting the worst aspects of the pandemic. Some researchers found that 87% of the stories are negative in tone in the US. The reason given is, well, we prefer it that way. Provisionally for 2020, COVID-19 was the third leading cause of death, trailing behind heart disease and cancer. A distinction should be drawn between a fatality from COVID-19 exclusively and a fatality with COVID-19 and other underlying health conditions, commonly called comorbidities. One research paper found that as many as 50% of the people reporting to a hospital had at least one comorbidity. Comorbidities are contributing to acute disease prognosis and increased risk of severe symptoms. Around 70% of patients who require ICU care have been observed to have comorbidities. Hospitalizations and death are correlated with higher age groups. Some of the highest contributors to COVID-19 severity are hypertension, diabetes, obesity, smoking, and cardiovascular conditions. These contributors have known correlations with lifestyle practices. So a plan to fight the virus would be based on rational immunomodulatory tools centered on healthy diet and lifestyle and proper prevention protocols. In summary, the research for this documentary concludes with these observations. The data indicates that COVID-19 is a high risk factor for the elderly people and people with pre-existing comorbid conditions. The risk is very low for other population groups. This known risk profile should inform public health policy and personal health practices. Healthy lifestyle choices help prevent development of comorbid conditions and help heal from existing conditions. Reevaluate or disengage from information sources that intentionally bias towards negative reporting and thus create unnecessary anxiety. Enjoy a beautiful and productive life in this amazing universe. Oh, and here comes Omicron. Don't worry, you know what to do. Live in good health.